feels like there's a lot of money there, and it does, but, you know, all areas in terms of the ministries.
Danny, please add a little bit for me, like, so what's going to happen? Because as the money becomes less and less, how do we continue to service? Are we going to have to be more innovative from a leadership perspective, or bring in the volunteer, or bring in the for-profits, or what are the...
I think that is the challenge, is what's going to be the right thing for your organization or for your area. I think joining together as much as possible, and you know, I can use the term amalgamation or merger, and people can think, sure, just because you've been through it, you think it's going to become a normal thing. I think more mergers and more sharing of services is not actual joining, certainly sharing services. And, you know, where can I go for HR help, and where can I go for, you know, we have to be more open to sharing within communities and sharing resources. And the resources need to go to the front, you know, to the actual service delivery. So we are going to have to be creative, and we are going to have to be even more collaborative. And, you know, coming from Northumberland County, I think we're a pretty collaborative group. But we're going to have to demonstrate more sharing. And
we used to always be able to make the case that we'll get more money. Well, we really aren't. That's not going to happen anymore. I think that's obvious. For 5 years at least in Ontario, there's no money. There may be even less money. And so how do you manage? How do you manage new needs? How do you manage expectations, you know, staff aspirations, and rising expectations for quality and accountability? You know, how do you keep your staff motivated in a flat, you know, limited environment situation? Like, to me, those are the, like, if you do your numbers, you know, it's interesting, you know, in child welfare, I guess people are just now entering this new phase. And it's simple, the child welfare directors approached me and said, how have you managed with no increases for the past 5 years? Like, no cost of living. I said, you'll find a way. Because we've been living this way for 5 years now, and other sectors are just coming to this. And so if you literally did a business plan, you would see in 5 years, your costs are going up 3% a year, your revenue isn't. Over 5 years, you've got about a 15–20% problem that you're going to have a plan for. Efficiencies or merger, you know, whatever the case may be.
Hannah, can you talk a little bit about the model that you're using that you're familiar with in the health group?
For how we're funded?
Well, just the way that it came together. It's an innovative way of service delivery and service management under the family health teams. I don't know if you could talk a little bit, because I think it's interesting to add this to the conversation.
Sure. Well, actually, because the family health teams are a cheaper way of organizing primary care, in that they've linked all the family physicians and they've organized them all into 5 teams, and within each team then they have pharmacists, mental health clinicians, nurse practitioners, some advanced practitioners.
Social workers,
they call them mental health clinicians. It's very similar to a community health center. And then there's a team administrator for each team who is, you know, handles a lot of the higher level administration for that entire team. They all have team meetings within each discipline and the family physicians, and share practices on, so that they all share electronic medical records. They're sharing the way they do things, how they're doing their clinic hours, trying to save appointments every day. And so that if one team is doing a particular thing or has used a study or a survey or a tool, then they share it with all of the other family physician teams and clinics. It's better for the patients, but it is a cheaper way to deliver.
Talk about the umbrella organization, which I think is kind of neat.
So yeah, so there is primary healthcare services, is the administration of the family health teams. So they handle hiring all the allied health professionals and dealing with the funding from the Ministry of Health that is granted for the operations for all those 5 teams. So instead of each individual family health team, like in the rest of the province, each individual family health team deals with the Ministry of Health, has a separate agreement. They're all under one umbrella of 5.
And that's what represents those 85 doctors.
Yes.
I think it's a neat model, a way of delivering services. I don't know if we'd see something like that in social services, how that would work, but it's just that they've thought through, and if you know the history of family practice in Ontario, it's gone from trying one model after another model after another model, and the doctors didn't like it and they didn't agree to it and they fought. And this one seems to have gotten legs, and the family health team concept has done that. But what I like about it and the work that I did with them was this umbrella team that does all the hiring and also recruits doctors.
Yes.
Is one of the other things. So you said they've gone to 2%. Well, that's a miracle in communities as well. So it's another way of delivering services. Thanks, I mean, that.
And it's just one other thing too, the physicians are, it is not just fee for service like everyone else, they get billing based on prevention-based milestones as well, which I don't fully understand. That is a different way of billing. So trying to encourage that if they've taken on more patients or they can meet certain criteria with
They also
level
serve,
of chronic disease, then the billing is geared towards.
right, it's geared to chronic disease treatment, but it's also based on the community they serve and the population within that. So some of it's population driven, plus patient driven. So you're right, the formula is a little hard to understand, but I think we're going to see innovative new ways of delivering these kinds of services. So
Well, at the risk of